And whenever you are ready, Lynn, you may start.
Thank you, Stephanie. So just housekeeping, as they say. So tomorrow from 9 to 2, there are time slots for one-on-one sessions with me. And that's if you want me to look at something specifically and talk about how to reframe it. Stephanie has put the link in the chat to the spreadsheet. So for those of you who may have already signed up, there's only a few people who have signed up. If you want to switch your time, it's not too late. If you actually want a half an hour and that's available, you can feel free to put your name into 2 slots if you think there's just more that we have to talk about. And I'm going to look at that later today or tonight. And so just be on the alert for an email directly from me that has my Zoom link, because we're not going to be using this Zoom so that Jill and Stephanie don't have to monitor and jump on all through the day. And I'll just have my Zoom open. I will also probably send you a calendar invite, but that comes from my iCloud, not my Davy Strategies address. So look in your junk mail, but you should get 2 different posts of that. So again, for people joining late, link to the one-on-one sessions tomorrow in the chat. Feel free to sign up for a time now or later this afternoon. Take as much time as you need if it's available. And I look forward to reviewing materials with folks. So today we're going to talk about social media. And I know some people even said, well, I don't really do social media, but I'm kind of curious. Why should we be doing this? So I'm going to share sort of how I help clients do social media, give you some examples from my clients who aren't in injury prevention. And then we're going to look at some from injury prevention. And yes, we're going to try to build a little social media post ourselves. And then I'm going to end with a fun little example of somebody who I think does great social media, who has left Maine to go to Georgia to the CDC. And that's the only hint I'll give you right now. So let's talk about social media. Why? I like to look at Pew Research for just a lot of public opinion, and they track social media. So, and again, you're going to get these handouts. So think of this as kind of a toolkit that you can use later and to refer to all the examples. But this was before Twitter. Whatever happened to Twitter happened to Twitter. So this is 2021. But nearly a third of Americans are regularly getting their news on Facebook. I actually haven't been on it in a couple of years, but the outer ring is 66% use the site, 31% regularly get their news. YouTube is the next. And I asked somebody about that, like, how are people getting news from YouTube? But a lot of people are like cutting off their cable and they're using YouTube TV and they're just looking at news summaries on YouTube and that sort of thing. So this can be helpful to look at. They also, here's how not to do a huge data visualization, right? They also break out demographically who's using what. So I think, this can be something that you might just want to check if you're saying, oh, I'm really trying to reach, 50 to 64-year-olds. Oh, they're not really on social media, or when they are, 1 in 5 are on Facebook, I better go there. So I just think kind of looking at these demographics can be helpful. Why do social media? Well, only because it will help you reach people you need to reach, to educate, to inform them of something, if it's an event or a resource in the community, or because you want to align with colleagues and others and share each other's research and know what people are doing. And secondly, because the immediacy of social media engagement and interactivity are ways that you think are going to help you do that. And I say that just because a lot of people just assume they need a social media presence. And sometimes letters to the editor, op-eds, fact sheets, and infographics, and email newsletters are better ways to reach their particular demographics. But I want to talk about key steps in crafting a social media post. First, determine your goal. Like, what are you trying to do? Is it to drive traffic to a website or to a report? Do you want to share a resource with a specific audience? Are you just trying to increase engagement or let people in the community know that you're out there? These are all different reasons, and so they should really produce different social media effects, right? You also want to know the audience that you're trying to reach. Is it Do you know their interests? Do you know their preferences? What are the demographics of that audience? Are they going to respond more to text? Are they researchers, and can they deal with some of the jargon and some of the graphics and some of the data and research results? Do they know what, when they see RTC, that means randomized, or RCT, that means randomized control trial, that sort of thing. Will they respond to humor? Is that a way to get people's attention? Use compelling images. Social media is good for imagery, right? But when relevant, not always. And use hashtags. This can be a difficult thing. Like, what's the hashtag I can use? People search by hashtags. So if it's Child Abuse and Neglect Prevention Month, they're going to look for hashtags. And you can just use the search function, the explore function. Each platform has a slightly different way of talking about it, and start typing things in. And you can see, for example, on Instagram, what hashtag has the most engagement, and you can use that hashtag that's relevant. The best overall framing strategy, this is where I start, is I help clients determine their core message. So this is what we've been talking about for the last few days, right? Why does this matter? What's the problem? What are the consequences of that? How do we solve it? And who can solve it? Who can play a role? What can that role be? And then draft a variety of social media messages that flow from the core message. So what I tend to do is I produce these messaging templates, and I'm going to show you one in a second. And then after that, develop a social media message bank, if that's going to respond to the audience and what they're trying to do and who they're trying to say it to and that sort of thing. So here's an example. I'm just going to ask you to not screenshot this because it's proprietary to a client. I'm helping a pediatric improvement project in a state that is trying to get pediatricians to understand about ACEs, resilience and trauma. So they have this goal of changing provider practices and clinical norms, getting more pediatricians to screen for ACEs, and getting more practices to become trauma informed. And they're providing all the technical assistance and support for them to do that. So here's their overall message template. You start with a value. We're starting with this idea that medicine relies on innovation to solve problems, and we're facing some challenges today that we kind of have to roll up our sleeves and think about how we can address this. Then that causal story: problem, consequences, solution. I like to use metaphors in my work so that it helps people understand complex things with something they know. Everybody knows what a piece of fabric is, right? So we're going to think of health as a fabric that's woven of many threads. If some of these threads are weak or loose, that can really compromise the entire fabric. Then you tell them what those other threads are, and then that leads to their focus on screening for ACEs or creating trauma-informed organization. And then they repeat the value, and then they have a list of sample asks for the different, community members. So this is something that you can do as well, is like have this, share it with everybody who's communicating, be aligned on what your core message is. And then what I do is I develop just in Excel, you can develop something like this, where you have the medium, Facebook, Instagram, LinkedIn, Twitter, what the message is, what the resource or link is that you're going to include, who the audience is that you're trying to reach. You can attach images if you have an image bank, and then also write what the hashtags are. I've seen other people use this sort of thing and actually put staff members who are going to be responsible for it. It can link to tracking, etc. So in terms of framing social media, this I think can be a really, really helpful strategy. Just start with your core message and then just start playing with, the things that are going to be appropriate for different social media posts. This looking at the top one. Have you heard about the great work in helping pediatric primary care practices detect and respond to patients experiencing significant early adversity? If they're going to put this out to other providers that are familiar with ACEs, they could say that word, right? And then they're going to add hashtags and images. Any questions on this before I move on to some other examples? Okay, so managing and tracking social media is something that, I don't specialize in, but I at least want to refer you to some resources. There are lots of social media management services. You can Google that term. But there is one that I'm going to show you here. It's just from the spreadsheet.com app. And it's going to reload for me here. You can have a bunch of hashtags that you draw from, again, images, what date you're going to schedule it for, what the status is, if you're assigned it to somebody ready to post, blah, 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 post on this. Then there's a scheduling tab. There are channels so that you can then buy each channel or medium, Facebook, Instagram, YouTube. You can look at all of the average views and likes and comments and shares and how many posts you did so that you can sort of see what's working for you and what's not working for you. This is another one that you can do. This is by post, right? So this particular post, which is linked to the first tab, went here, and this is what happened to it. The channels one is a way to collate all of that information. So again, just let me go back to the keynote. There are lots of ways to do that, and there's lots of free templates on, in spreadsheets, and there are resources that, you could pay a nominal fee to have some social media management services. There are also hashtag generator apps, but I find that it's easier to just use the search function or the explore function on any particular platform. So let's look at some examples of how to do this. I'm going to share some work from clients who, like I mentioned, aren't in injury prevention, but sometimes it can be easier to kind of get it if it's not, the issue closest to your work and to your heart. Here's the goal of my client that was a newly formed regional economic development initiative. They wanted to raise awareness in the community that they are there and the work that they're doing. They also wanted to reframe workforce conversations towards structural issues because they had been largely about disparities in income and race and disparities in zip code, et cetera. And so they wanted to reframe it. And here's just a few social media posts that I developed for them. How different is a living wage from the minimum wage? $5 an hour, $10 an hour? Actually, it's roughly $20 an hour more than the minimum wage. Find out what we're doing to change this. Then we linked it to an infographic of the data that was on their website. So that's a strategy, or a tactic rather, is ask a question that can engage people because they want the answer. Another idea, we have a vision for long-term economic resilience in our region. Retweet if you share that vision. So that is an easy ask, right? Just asking people to retweet if they share that vision. And then we attached a clickable image to the report that they had on their vision. And then another one, Springfield's greatest resources are people. The way policies and programs work can either block or unlock the potential of our residents. We're focusing on unlocking potential. We're doing this 2Generation, which is parents and kids program, linked to that information. And as you can see, these all are following good framing principles, right? They're sort of positive. And it's just an example of how to spread the word. Another client of mine was trying to educate and build support for primary prevention for child abuse and neglect. And so they were really focused on policy around home visiting, early care and education, and family resource centers. So here's an example. Home visiting programs match trained professionals with new and expectant parents to promote healthy growth and development, and when necessary, connect parents to essential resources. Find a home visiting program near you. And we created an interactive map of not all of the home visiting programs, but at least those that were Healthy Families America and a couple others that were licensed and that we actually had the information for. So this would be targeted to not just parents, but also health and social service providers who are working with families and kids. And then another said, have you heard about home visiting? So, and then it I won't read it all, but then it defines what it is. And it says, hey, we're trying to expand this particular program for eligibility requirements for that program. So more parents can, engage in home visiting. Will you offer your support? And then it went to a link on their website, which was really their advocacy stuff, to get people to fill out a support form. And then they're collecting information on who they can rely on, right? When it comes to the actual bill hearing in the legislature for people who might write letters to the editor, call their legislators, et cetera. And then they use this, which is just an image from one of the family support home visiting programs. So this was targeted towards their allies, other people in their field, other people who are actually doing this work, and sort of policy attentive folks in the broader network. You might be saying to yourself, yeah, but what if none of these people follow me, or how do so a lot of work to make social media really meaningful is finding out who you need to follow you, and you follow them and request that they follow you. And so that can, be a little bit of a slog if you're just sort of just getting started. And then finally, or maybe not quite finally, second to last, is a client of a coalition of people who work in aging, with mental health and developmental disabilities. And they have this big project for several years to try to support the state's direct care workforce. So direct care, personal support workforce is kind of in shambles in our state. So they've got a long project. Social media was used to accompany this a release of an economic report on the state of the workforce. We also wanted to craft social media that would be used throughout the length of the project and help bring people into the tent and build the coalition. So here's an example of what they did with this report. We need to create the conditions that all Maine people need to be healthy and safe, regardless of ability, age, or health status. A new report by the Maine Center for Economic Policy, and that organization is like what you have in the Georgia Budget and Policy Initiative. So it's a nonpartisan budget and policy think tank. This report reveals that workforce shortages are leaving many of our neighbors without basic needs. Will you read and share the report with leaders in your community? The report was hyperlinked. So again, easy ask, spread the word, get more people to know this. They did another version of this with a different ask. Will you take the pledge to support our work? And then they have a pledge button on their website, and a pledge that's just one paragraph, and it gets people again to sign their name, give their email address and town, so that they are, building the coalition and building people who are supporting the work. And then we had a bunch of images that are designed that pull out particular pieces of data from the report. So this one is, 1 in 6 Maine people report having to care for an older adult. That's 186,000 Mainers, and a similar proportion report providing care to an adult with a disability or illness. We also have several versions of this. So we have people of different races, of different ages, of different ability and health statuses, so that we can, use the same data, but sort of help people identify with that a little differently. Here's another one. Maine ranks 44th in access and affordability. So 8,000 Mainers are out of the labor force caring for loved ones. So again, these are just sort of some of the data points for the report. Everything gets linked to the report. And this is built off of that core narrative and message bank. And then finally, before we dig into injury prevention, this is injury prevention, it's public health. A client who we did some research and we found out that most people didn't understand that it was lead dust that poisoned. Parents were really focused on peeling paint. And so, and didn't believe that there was anything to be done to reduce exposure. So they wouldn't get their kids screened, because then that would just make them feel badly about having a kid with a high and elevated blood level. So they wanted to educate about lead dust and build a broader coalition, businesses, pediatricians, landlords, because they had policy goals to really hold landlords in rental properties in low income areas more responsible for lead abatement. So this was the poster they were using all the time. At 1 and 2, testing for lead is what we do. Catchy, right? Lead poisons people, especially children. Ask your doctor about having your children tested for lead at their first birthday and again at their second birthday. These were in pediatric offices and in other places and social service organizations around the state. And they, weren't seeing any movement on screening after years of using this. Any idea why? Like, if you saw this in your kid's doctor's office, would that say, oh, right, I want you to screen my child? What do you think?
It doesn't really speak to me as to the benefits of screening, like screen for lead. And then if my baby comes back positive, now I feel like I've poisoned my baby and there's nothing I can do about it.
Right. Yeah. And this is exactly what the research that we did in the community found. Okay, stop doing this. Can we, and this was in New Hampshire, which has really old housing stock, like a lot of New England. So we did you know, 60% of homes in New Hampshire were built before the ban on lead paint. So the dust settles on floors, toys, it gets into our bodies when we breathe or swallow lead dust. So lead poisoning is caused by dust from deteriorating paint in older homes and buildings. Visit our website. And the whole, they had to take the pledge thing. And again, this, this doesn't solve a problem, but it's changing the conversation to make it more about, look, this is around all of us, but without it saying, oh, well, then it can't possibly be harmful, right? We wanted to show the specific mechanisms by which it could be harmful to children. And then we had fact sheets for parents, for landlords, et cetera. And they actually, after a year of this, they passed legislation that required that landlords who have rental housing have to notify if there's been a lead positive lead results for kids in rental properties. The landlords have to do something about it. They also reduced, because the CDC says there's no safe lead level, they reduced the micrograms per deciliter or whatever it is from 10 to 5 before the state would have to then send some information and that sort of thing. So, but again, this it's making it more of an us problem than a you issue. Okay. What about injuries? Let's just talk about your stuff, right? Enough about other people's problems. Can communicating on social media help reduce injuries? Well, the research isn't really clear about whether it can ultimately help reduce injuries. But what is clear from research on social media use and injury prevention, we can use social media discussions, particularly reaction to events and other news, to reshape what people know about injury. And I think this would be a great entry point for a lot of you is, you're following other people, you can search for hashtags, you can see what's out there, and you can say, wait a minute, this is what we know, or, hey, this is what's happening in our community, or did you know about this program? Just getting ready for some of the one-on-ones tomorrow. I'm just so amazed by the work that you all are doing, such important work and things that I had never even considered, you might be doing in public health. So I know nobody else knows that either, and I'm attuned to public health. So you can search hashtags, you can join a discussion, and you can share a resource. So let's look at how to do that. I went to LinkedIn the other day and I just searched for the hashtag TBI, concussion or traumatic brain injury. And Merrill Hodge, I don't know if you know who this is, but he was I think he played for the Steelers. My NFL career ended because of improper care of a concussion. That's why I'm going to continue my mission, blah, blah, blah. So there's some tool he's forefronting here. Sportgate, don't know what that is, but you could always just search this hashtag and come behind it and, share the CDC's parent concussion guide that we talked about yesterday, or add another resource that gets more people to know you're out there. You can also see who you might want to follow and ask for them to follow you as well. Here's something else that I found in a campaign. March is Brain Injury Awareness Month. Join the Brain Injury Association. This one's in Ohio, working to create a better future through brain injury prevention, research, education, advocacy. It doesn't really say much on its own, right? But this is something you could come behind and say, hey, this is what we're doing in our community, in our state. This is how we're working to create a better future, et cetera. I see these opioid campaigns everywhere. Many of them are really just about trying to get people to understand opioids are addictive and dangerous. Like, we don't all know that now. But prescription opioids can be addictive and dangerous. It only takes a little to lose a lot. I don't personally find this to be terribly helpful, at least at this stage in the game. It's not, it's a personal responsibility, right? It doesn't tell the story of how this happens to people. I mean, there is a prescription bottle there, but even something that isn't on your frame, you could come behind it and say, hey, that's why we're educating law enforcement, community and public health leaders on what works to prevent overdose. Then link to something like CDC has prevention strategies, community prevention strategies that could be linked to. So, but you could have your own resources as well. And I mentioned this because you can't, you can't sort of, hijack the frame towards your thing and turn it around. But especially for organizations that a lot of people are going to see, and there's going to be a lot of engagement, it can help for you to be part of that discussion and giving people a resource. If it's something like this, however, I would just stay away from it. Okay. I'm not supposed to be the one to pick which sneakers I'm going to bury him in. Sidani, you have a question?
Yes. In regards to coming behind one of these posts, how will we do it? By like a hashtag, or are we like in the comments, or are we just referring to it in the content or caption portion? Where, like, how exactly are we connecting?
Yeah, thank you. In the comment. So if this were on LinkedIn, you can just be in the comments and add your own, you can add your own link even in a comment. You could do the same thing in, if you're using Instagram, you're like, well, this is what's happening in our community, link in my bio, right? And everybody, if you don't know about this, raise your hand and ask a question, but you can have a link tree in the bio that's associated with Instagram, because you can't put actual URLs in the comments and have them clickable. Don't know why. But you could also retweet, right? Or if you're still on Twitter or on Facebook, you could share that post and then make your own comment on it as well. Does everybody understand why I would suggest you not actually engage with this if you're trying to do more public health approaches? Okay, so what does this tell us? Sort of do's and don'ts that I'm putting together for you here. Use positive emotional framing, use humor if you can. Don't incite fear, which is what I think that last thing did. I mean, it makes us feel sympathy, right? But it doesn't tell us what to do. And it doesn't really really engender any civic thinking. Yes, Ursula says in the chat, it makes me despair. Exactly. Do follow those you want to reach and do share and engage with their posts. So I follow other public health researchers, follow if you're trying to get in the news, follow the local reporters who are on the health beat, and news directors, and, follow your congressional delegation if that's relevant, and share and engage with their posts. You can tag them in posts, which they will see, hey, I wanted to bring this to your attention, etc. But don't comment critically. Rather, you can pivot to your frame. I wouldn't ever, get into it on social media like, oh, well, that's a good idea, but I think this is better. Just say, hey, here's something else we want you to know about on this topic. Do use images that help explain and point to solutions. I read an interesting research study on safety and social media that found that regardless of the audience's sort of social media literacy, that if you used imagery that didn't exactly reflect the safety condition you were trying to promote, it can confuse people. So if you're going to have text of a sort of like, do this, or here's a way to prevent falls, or here's a way to prevent injury in pedestrian injury, we're going to talk about that in a second. Make sure the image actually is evocative of what the text is. And don't use images just because you can. All right, let's see if there are any. I think that was my last point before we're going to build something on our own. There is a question in the chat. These are helpful tips. I'm curious if there's strong evidence literature base for social media strategies, both for messaging and images. And injury, it can be very easy to go to fear-based messaging and images, but a literature review I did over 10 years ago about general HP communication suggested positive images involving faces in particular drew attention and less known than what impacts behavior, except donating behavior. We focus on the behavior we want to see, but it's often difficult to find good images. Someone putting on seatbelt versus showing a crash. Right. Yes, thank you for that. And thank you for the literature review that you did. And I think your points are exactly what my understanding is as well. But the images should be aspirational. But it's so easy to find the other stuff. And it's so easy to see what we don't want to have happen. So what I do is also create image banks. So there are two, you probably know about iStock Photo, but that where you have to purchase, but in the chat, I'm referring to something called Unsplash. So I have collections of images on Unsplash where it can be difficult to build it. You have to search for a lot of different terms, but I have a child abuse and neglect prevention collection of images. I do that for every single client to make sure that the images are going to align with what we're seeing. So you at some point have to make the call, right, about what's going to get someone's attention. But if you get their attention, is that coming with some stereotypes and other frames that they have in their head just because of the images? So the best thing, and what the recent research I've read, is that you want the images to align with the frame that you're suggesting. You want frame coherence. You want to fight the schema mental model fight, not just the sort of fact on the ground fight. So make sure that everything that you're putting out there is telling the same story. I don't know if that answers your question, Jeanette.
Yes, thank you. That helps a lot.
Okay.
And if you're aware of any sort of literature reviews or that have been done more recently, that would be super helpful too.
Yeah, I could go into my Zotero list and create a bibliography and share that with folks. That's like an EndNote thing. It's an EndNote software. Okay, so now it's Pedestrian Safety Week. And we're going to, I don't know if that's a thing, but let's pretend, and let's do some social media to promote it. Okay. So there's already a canned campaign, like TV, radio, posters like this that are PSAs, social media posts, et cetera, from DOT, from the Federal Highway Administration. And these are two of the posters. And I'm curious if you would use one or both or neither of these if you're trying to promote pedestrian safety. What do you think? You can come off mute and discuss. Even if you have mixed feelings or you're not sure.
Well, the other one is positive and one is negative. So
Yeah.
as I say, like normally the positive works better, I find. I mean, you can scare people, but
Yeah.
I'm also struck though by how the color scheme is exactly the same. And so the positive one is positive, but the color scheme makes it look negative.
Yeah, doesn't it? The black and white, and yeah, I don't think they're doing that just to make it more easily printable.
oh, and I agree with what Lisa said in the chat about she's not sure she appreciated the pun on the right. And I was like, oh yeah, that's not good about think of the impact you could make. Mhm.
Yes, think of the
That's-
impact you could make. Like, were they? Why did they do that?
Yeah, Lisa, I
Did
didn't see it until she stated it, but I was like, oh yeah, that's no.
Yes, I don't know if that was intentional or not, but it's really disturbing me that it might have been, right?
Yep.
And the other thing about the one on the right is, okay, wait, and because they're going to be using many of these. So the idea is that you'd use one day and one the other. There's a whole bunch of them. You can go to the FHA and find it, but we're telling people to cross safely, but then we're showing that drivers don't stop anyway. Like, oh, I was looking for other cars. I was trying to be responsible, right? But I didn't see the mother and the child in the crosswalk. So I'm not actually really sure about this. And the stroller is awful. And then Sarah Beth is saying left, but would appreciate the strips aligning with the person. So would I, because they did this curved bottom. I'm like, wait, where is the little girl going? Which way are they really crossing in the crosswalk? Right. So I just want to say, like, this points out, even when you have so many resources and you're developing a campaign and you've got designers and all this place, like, some people are just not thinking about framing. So if you're thinking about framing, I think you're going to be better off than a lot of these nationally, funded campaigns. So, okay, maybe we'll think of some other visuals that we could use. I'll show you some in a second. Which strategy or post would you use? Now, these are two totally different strategies that I'm going to show you, but think about which or both or why. On X date, our pedestrian safety campaign volunteers will be appearing throughout the city, asking pedestrians to dress for safety. Last year alone, 6 pedestrians were killed. They might be alive if they'd been wearing reflective materials and carrying a flashlight. You could help our city by be safer by participating in an assess the dress conversation. Thoughts about that?
It's very specific and it tells a story. Maybe not very positively, obviously, but it's the reality of what happened. But also saying they might be alive if.
Other thoughts? Yeah, so blaming the victim, blaming the pedestrian. So I live in a city, I walk to my office, I don't carry a flashlight. I don't, so they are going to spend, this is an actual thing. I didn't make it up. This is part of the DOT campaign where they are encouraging people to have these conversations around the city, right? To change how people dress so they don't get hurt. And I just, I find that to be a little bit of a strange focus. So comments in the chat, yes, blaming the victim. What about non-deaths? Thank you, Elizabeth. Injuries. It does seem to encourage judgmental attitudes and approaches, Jeanette. Thank you for that. Are we going to start policing each other about, oh, well, they got hit in a crosswalk, but they were in a dark suit, What if people have uniforms for work? Exactly. So I had been looking at this campaign and had just happened to see a social media post in my city where the city announced that they are going to be repainting all of the crosswalks. They do it every spring. It was just like a reminder, hey, it's crosswalk painting time. So, traffic might slow down, just be aware of our workers out there. That's what they're doing. So it made me think of something like this. On date, whatever, our pedestrian safety campaign will be assessing the safety of major crosswalks in our city. Last year alone, 6 pedestrians were killed. As part of its efforts, the campaign is asking for residents to let them know, where there are poorly painted crosswalks, cross signal problems, or other issues. So they could link to and interact to a survey that gives people a place to respond. They could link to an interactive map. There are some municipalities that have something called Fix It, which is an app where you could just tell people there's a pothole on Elm Avenue and the city will then respond to fix it. So this is a different tactic, right? So, would you do one or the other thing? But I think we're also so used to individualizing the solutions and thinking of injury as people being personally responsible. What could we do to get people to think, an actual strategy that there are, that the built environment matters here as well. So any other questions? We can look at the chat. Yeah, how about having conversations about maintaining posted speed limits for drivers? All kinds of good outcomes from that conversation. Also made me think of law enforcement officers, yes, who were struck at a traffic stop. Were they to blame? Right. So, my point here is in just expanding our thinking when we're doing things like this and doing things in injury prevention, and not just focusing on the individual people who are hurt or who actually might accidentally cause harm to other people, but what are the aspects of the way that we live together that could actually, be causing danger and we're not even aware of it. Does this make sense to people? So I know we're talking about social media, but expanding people's thinking is the idea. So what about these? These are some other stock images. Be safe, be smart, be seen. Make sure drivers can see you. Take the time to cross safely on the lower left, and then the image on the right. Which one or ones would you choose? And you can use the chat for that. Upper left, lower left, right. None.
No, I would
Oh.
use I like the one on the right, but I'd rather have the pedestrian facing the driver.
Yep.
Like, make sure drivers can see you, but I'm not even looking at the car. I'm looking at my happy place. So maybe make sure drivers can see you could be the heading over the picture, and then the pedestrian could actually be looking at the driver, and the driver could actually have eyes and they're looking at the pedestrian.
Right. I think that's terrific. And also maybe making the red on the traffic signal brighter than the green so that it's clear that the car should be stopping.
Mhm.
The thing I would say, my critique about the one on the upper left is that you have to sort of squint to understand that that's a crosswalk. So just making that a little bit more obvious.
Oh, yeah, I
And-
didn't even get that.
Yeah. I mean, sometimes it's because we're so used to looking at these things and our minds fill in the blank, like the one on the lower left, we're filling in the blank, but there's no crosswalk there. And so what the research suggested on this, right, is that there should be a crosswalk, like make sure the image is saying what you need it to say. And here we just see a person moving. So show what it means to cross safely. And then I think all of these, with those adjustments, all of these could work. And yes, and Lisa's saying a combination, literally the ecological model. And I'd love for you to say more about that, the ecological model, Lisa, so everyone understands. Would you mind coming off mute?
Sure. So the idea that there are multiple roles that can be played in addressing an issue. There is the individual behavior, there is the community of drivers, there is the environmental aspect of having crosswalks in the right place or right places. There was a very famous pedestrian fatality here in Georgia before the pandemic, where a mom had a 5-year-old in her hand and a kid in a stroller, and she was crossing a very, very busy state road, and she was trying to get to the bus stop. And the crosswalks were placed like 2 miles apart on this particular road. So she was jaywalking. And the discussion really became about, well, what mother would, expose her child that way? That was one of, the many comments on social media. But then the conversation started to shift of, okay, first of all, the cars are going too fast. The drivers are supposed to stop for pedestrians in the road, no matter where they are. And that she was literally, would you expect a mom who's got 2 little kids to walk 2 miles to the crosswalk and then walk another 2 miles back to the bus stop?
Right.
So it really changed the conversation, I think. And ultimately the DOT ended up putting in safe crossing at major, corridors. So there is a role for each one of these drivers, the person and the environment. That was my main point. I mean, they all are pretty simplistic, but yeah, I just when I saw the collection together, I was like, well, if they were, and that's one of the things that I get, I get frustrated with, like the last couple of posters you put up, is that they don't talk about using things in tandem to address policy, environment, education, or the ecological model of the person, their family, the neighborhood, the community. They don't go through all of those things to have kind of that multiple perspective look at.
And,
so it's probably more than you wanted.
No, that's excellent. That's excellent, because what if we did all of that and we did it specifically, we were explicit about it, not just saying we all have a role to play in pedestrian safety. That's not enough, but saying drivers, pedestrians, urban planners, etc., have the responsibility of keeping us safe. And this is my role, and this is your role, and this is how we do it. Instead, we tend to just see stuff focused on, assess the dress and carry a flashlight. So, yeah.
I've started using a Giphy from Shrek a lot, where Shrek tells Donkey it's an onion, because it's not. People want a silver bullet. They're like, oh, the solution is simple. You don't, it's like, no, the solution actually is not real simple. It
Yeah.
involves planning and money and behavior and understanding convenience and time and ability, accessibility, all those things.
It does. I know. And that's why sometimes this can feel like it's so much easier, right? To just say, oh gosh, just pay attention to the crosswalk, right? Let's low hanging fruit this thing, right? Thank you. In the last few minutes, I wanted to share something that would bring us some laughs, because this is all difficult stuff. And I don't know if anyone has heard of Dr. Nirav Shah, but he was our CDC director here in Maine during the pandemic, and we were so lucky to have him lead us through that time. He was recently appointed deputy director of the CDC, and he is an excellent Twitter user. I don't know if he's still using it, but I just wanted to share this great way that he engaged people in staying safe during a terrible cold snap we had in February, where it was like -60 in some places. So he does a thread. This is another really good thing, is using a thread. Hey, y'all, I don't know if he had some Georgia in him already. It's going to be cold in Maine this Friday, Saturday, dangerously cold. Some might even say wicked cold. We say that up here. So like if you normally snow blow your driveway in shorts and flip-flops while sipping a Dunkin' Donuts iced coffee, take note. So he's tagging Dunkin' Donuts. There are people who actually wear flip-flops in the winter, so he's just playing into the humor of this. But it's a thread. And that's another way to get complex information across, is to do a thread like this on Twitter, or hopefully some other platform. How cold is it going to be? Well, at Todd Gutner, he's a meteorologist, AKA Hot Toddy. He just made that up. Forecast wind chills of -60 in the interior. He bases his prediction on #science. So, they must be right. I'm told he even uses a computer. Like this is good stuff, right? Number 3, I mean, honestly, maybe -60 isn't that cold. Here's a list of places that will be colder. Mars. For reference, it will be around -45 at the South Pole. They've got it good down there. Then he has a weather in the South Pole thing. What should you do about this? Stay warm and don't get cold. Let someone else pay to heat you up. Here's a list of warming centers across Maine from our good buddies at Maine's Emergency Management. The list will be updated often, so please, so then there was a link. And he's getting lots of engagement on this. Look, I literally ride to work on a moose, and I'm taking this seriously. Hypothermia and frostbite are risks. Avoid them by layering up, not wearing flip-flops. I'm looking at you, Robert Long. I'm not sure who that is. But then he has links to 2 really good infographics with symptoms. So even if you lived in a lighthouse your entire life and subsist on lobster, this cold is different. It's going to be once in a decade cold. Like, the only thing you're going to talk about between now and Sunday is the cold. So maybe ice fishing can wait till Sunday. I'm taking this seriously by staying home to make sure our pipes don't burst. And if they do burst, I'm immediately going to a warming shelter, since I don't know what to do if pipes burst. Here's what to do. Then he links to what to do if your pipes burst. The only people happy about this are the waddle of penguins in our backyard. If this sort of cold keeps happening, I'm going to get more penguins up in here to hang out with my moose. Perhaps also that seal from Cape Elizabeth, where a harbor seal was wandering around the neighborhood, and it was quite the rescue operation. So I will stop sharing there. But I thought, what a fun way to get people information and engage with folks. So yeah, it's great. All right, we have a couple minutes left. If there are questions, again, you're going to get a handout of all of this so that you can, if you like, mimic some of these social media posts. But did you have any other burning questions? How does it go for you? Things you want to share?
Do you have any opinions on TikTok?
I have opinions. I I don't have any clients who use it, except for a foundation that focuses on youth engagement. So, but I think, you know, looking at that demographic piece and who are you trying to reach and who's using TikTok, and if you can do a video that's fun and engaging, great.
Are there any more questions for Dr. Lynn Davy? In addition, I'll put the, we'll go ahead and send out the link for the Google Doc if you would like to sign up for the one-on-one sessions. And if you didn't already send in a sample of what you would like to speak on tomorrow in your one-on-one session, you can go ahead and send it to the iPrice email. I'll put that in chat in a second. And we thank you so much to everybody that attended today. And if you are not able to attend a one-on-one session tomorrow from 9 to 2 because it just does not fit your schedule, you can go ahead and email Dr. Lynn Davy. She put her email in the chat. And if you're not sure, you can just email me at sverda@emory.edu and we'll get you all scheduled. And we look forward to seeing you guys at your one-on-one sessions tomorrow. Thank you so much for attending.
Thank you. Yeah, and thank you for saying that. If tomorrow doesn't work for folks, we can find another time in my calendar if you want to chat.